The mandatory NHIF membership is an upgrade of the former scheme where only workers in the formal sector were compelled to join. Persons above the age of 18 shall hereby be required to pay a sum total of 6,000 Kenya shillings annually. Calls to have a new board apart from NHIF that shall propel UHC to actualization were however rejected.
Who wanted to frustrate this bill, I would only say shame on such a member. Shame on such a member, because really, Madam Speaker, we cannot play politics with such an important piece of legislation.
We were lobbied to have this bill defeated in your hands, but there is no way we would have allowed such an important bill to die in your hands to punish you.
The bill now proceeds to the Senate, and members of Parliament have pleaded with their fellow legislators to hasten giving it a nod before it proceeds to the head of state for ascension.
Families are actually not just losing a dear one, but they're having to lose even all the property they have as they try to pay the bills. And we hope with this bill that this National Assembly has passed, and with the cooperation of the Senate, that we will see the end of that misery.
And so mine is just to say thank you. Let's not politic, but let's continue with the same spirit.
A lot of that happening, especially with this COVID situation.
In a bid to make the amendments functional and spread the cover to a larger number of Kenyans, the NHIF shall however implement caps on treatment for chronic illnesses. Patients who undergo dialysis shall bear with a reduction from 9,500 Kenya shillings down to 6,000 Kenya shillings, MRI from 15,000 Kenya shillings to 9,600 Kenya shillings, and CT scans from 8,000 Kenya shillings to 6,000 Kenya shillings. It is a relief, however, for employers after members of Parliament rejected the proposal to have employers match their employees' contribution to the fund.
All of us in this House have been contributing towards medication of our constituents. With this bill, if it is assented to, that burden will be reduced. It will not be eliminated. Let's not cheat ourselves, but the burden will largely and significantly and substantially be reduced.
According to Ministry of Health CS Mutahi Kagwe, the move is not only going to be beneficial but also affordable for Kenyans.
This is the way to go forward, and this is the way to ensure that we create access to healthcare in the country and to make sure that our families do not get impoverished as a result of hospital bills.
Defaulters have however been warned. Employers who remit their contributions beyond the 9th of each month will be liable to a penalty of 25% of the outstanding contribution, and also foot all medical bills for workers who fall sick within the default period. Individual contributors who fail to pay their premiums by the 9th of every month shall pay a 50% penalty and pay the cost incurred by the employees when seeking treatment from a contracted healthcare provider during the period when the contribution is due.
Will as many of a contrary opinion say nay? The ayes have it.
Ben Kirera, K24, Nairobi.